Hello, Hagerman Joint School District community. Lately I've been getting a lot of questions regarding the numbers and severity of COVID in our area and our justification as a school board and administration of how we classify what risk level we're at and opening school. Now, I'm a numbers guy. For you that know me, that's what I do for work. A lot of analytics. And what I wanted to do today is, like I said, I've been getting a lot of questions looking at the numbers. Tell me about the numbers. I want to walk you through the numbers. There's a lot of great resources available to us that give us real data as to the severity of corona, the spread of corona. Now, in no way is this a political discussion. I want to keep it very non-biased and just walk you through the numbers that I go through to understand the risk of COVID and the spread of COVID in our area. And it'll show you how we justify our classification for opening school. So let's jump into the numbers. All right, I'm going to show you a number of different sites here, and each of these sites I'll provide the links in the description so you can have access to it for yourself. I greatly encourage you to go out and do your own research on this if you feel uncomfortable. But what I want to do is show you the process that I go through when I'm wanting to look at, what are the true numbers, what is the severity in our area, and how are we analyzing what color category to start and what risk level we're at in order to open school here at Hagerman Joint School District. Again, this is just Hagerman, just our surrounding area. I'm not making statements for the entire nation or anything like that. So, yes, you can feel free to make comments, but keep them nice, please. Anyways, I'm going to try to be as unbiased as possible here and just show you the numbers. I'm a numbers guy, like I said. And so here's the numbers. First of all, great resource. Go to our HJSD.org site, and you're going to see a new tab here, and this is our Return to School COVID tab. We have bus protocols we've talked about. Yes, we are insisting that folks wear masks on the bus to protect our drivers, but then there's also the overall protocols for school and decision-making criteria. Committee of both the administrators and the local community got together and created these colors and metrics by which we're going to follow in order to safely open up school. Now, I will let you know that it is the yellow category that we're going to open school up. And how is that set up, or how do you categorize us in yellow? Well, let me show you. There's some great tools out there. We've been working very closely with the South Central Health District. They've been a great resource, and their site has a lot of great data. The local hospitals, we've been working very closely. I mean, we've had numerous meetings, and everybody has been it's been great to work with these folks. And, sometimes you have to sift through the numbers a little bit, and I'll show you that. But the numbers are out there. The information is out there, and it's a great resource. And South Central Health District has been improving their site almost daily. And I'm going to show you a new improvement I just saw last night, which is huge. How do you do that? Let's just start off by searching for South. Let's see. SOU, South Central. As you can tell, I've searched multiple times. So let's go ahead and go to South Central Health District. And we are region 5, so let's go ahead and just click on that one. And here, front and center, you see coronavirus, like everybody's site. So go ahead and click on that, and you see now it's /coronavirus, the site that you're at. And that new resource that I was talking about is their regional risk levels. South Central Health District has gone through and created their colors. In fact, they have the exact same 4 colors that we do. We calculate them a little bit differently, or we weight them a little bit differently. But here is a great resource. Again, I think this was just posted. It was just posted either last night or this morning, because this is the first time I'm seeing it. And here you see the regional risk level. And these colors, so it looks like Blaine County and Camas, they're in green, which is great. And then we look at Gooding County is in yellow, and we have a couple of Cassia and Minidoka in the orange category, but just click on it, and it will show you here the definition for each of these, the details behind it. Now, if I go here, let's go ahead and jump straight to Gooding County, and we see what makes up that color category of putting us in the yellow. The first thing is a positivity rate for the whole district. You notice that 12.09 number is the same for all of the different districts or counties. And that number is the number of positive tests, as explained to me, for each test that is taken over a 7-day rolling window. So, you would probably expect that number to be decently high. To me, that's not an alarming number, because what that means is people that feel they have COVID or they are sick, they come into the hospital system, they get tested. Our healthcare workers that are, working around COVID all the time, they get tested regularly. This is the number of tests that is positive for COVID. Out of all the tests that are taken for COVID, right now it's about 12.09. So again, this is a good number to know. But it's not really talking about the severity of the virus or the true spread of the virus. We get into average new cases. Now this starts to get into what is the spread in our area. These numbers have been set quite low. A lot of the numbers that we're pulling from is studies that have been done for very densely populated metropolitan areas. In fact, we've had to modify the numbers because they start off per 100,000, right? 100,000 people in our area. I don't think you can go a radius of all of our districts and get 100,000. But what we've done is said, or what South Central Health District has done is said, they want to know the number of cases per 10,000 residents and average new cases. And right now in Gooding County, which I think we have 15,000 folks, that average is around 2.22 people that test positive on a daily basis over a 7-day window. So some days you're going to have 7, some days you're going to have 0. Where do those numbers come from? Let me just show you that real quickly. If we go to South Central Health District and you click on, this is actually, you click on the weekly dashboard. And on the, no, actually on the taboo, it's right here. Okay, I'll send this link to you. But this is a new, also something that South Central Health District has improved here just recently. It gives you the breakdown of every county and the number of positive coronavirus tests per day. This is a great resource, starting from the very first day when it was being monitored back in March. If you look at Gooding County, 0, I think we got our first case, yes, on April 1st. And if you go all the way to the right, you can look at the 7-day window that makes up that value, that 2.22 number. Yesterday, or the 11th, we had 0 cases in Gooding County. That's great. And like I'll show you, the trend recently has been declining since the first week of July, which is great. Here it looks like on the 10th, there was 2 new cases. On the 9th, there was 4. And now, sometimes people can get tested multiple times, so it would count in these numbers. But if you average this 7-day window out and you say per 10,000 folks, it comes out to about, I'm just trusting the math, it comes out to 2.2. So that's in the yellow category. In order to get to green, you have to have less than 1 person test positive on average per day. So that's a very low number. Again, it's a great number to look at, but it doesn't talk to the severity of the virus or the risk factor. Now, for me and for the committee, a huge weight is put on hospital capacity. And this is where you get to understanding are our healthcare systems being overloaded? We do not want to overload the healthcare system. If you heard early on and you heard about flattening the curve, what did that mean? That meant we don't want this curve to just spike straight up and overwhelm the healthcare system. So, people are getting critically sick and they need to be admitted to the hospital. We don't want the beds to be full and for them not to be able to get that critical care that could save their life. We're looking at the hospital capacity as a key metric, and right now we're in the green category. The local hospitals around us have good capacity to be able to admit people that are sick, and that's not just for COVID folks. That's for, you look at the majority of the people that are being hospitalized, it's not for COVID, and I'll show you those numbers, but we don't want to overwhelm the healthcare system, and for us, this is a critical number, and so it's green. You look at new cases by average. From what I can tell, this looks like a 7-day total of cases. The category of 40 to 49 looks like about 13 new cases in the last 7 days. That's my category, so that's the highest category anyways. But obviously younger kids there's a very low risk, and I'm surprised that the 70 plus, which is great right now, is very low. And then we have this no critical circumstances, and this is looking at critical significant outbreaks in a healthcare system or a school or a facility, so that's green as well. So these two being green are great. It puts us at a moderate category according to South Central Health District. And we feel at Hagerman Joint School District that we feel we should open in a yellow category. And that means that, we're going to have minimal spread in the area, but we want to open with some additional precautions versus opening in green and not having those additional precautions. So the board and the administration has made the decision to open in yellow for us. Some additional sites that are great. And again, I highly encourage you to go out there and look at the numbers for yourself. Don't let people think for you. Don't let me think for you. Go out there. I'm just providing you the resources, the links, because it's kind of difficult sometimes to find where all this information is. Here is, South Central Health District's definition, and we've kind of gone through this, and this is just without the actual new numbers, which is by county, which is awesome. The other numbers that I really like to look at are if we go in and looking at the weekly numbers, and here it has two tabs in the weekly numbers. The first tab, and again, don't get alarmed. There are some numbers that will contradict each other a little bit. It's hard to get all these numbers perfect. I don't blame anybody for that. I've worked with numbers all my life, and sometimes you don't have the exact numbers that match up perfectly. So when you look here, what is great that I like to look at is the number of cases. And this is for the whole district, which includes Twin Falls, Blaine County, the South Central Health District as a total. We look at, we did have a spike in new cases around the mid-July timeframe. But look at what's happened over the last, and these are a week's case. Look what's happened over the last 4 weeks. Dramatically dropped. In the week of August 9th, dramatically dropped. So we're going into school looking at very low case count. Numbers are trending down. Daily symptoms, again, these numbers don't quite jive with these numbers, but whatever. But the trends do. So we see these trends going down dramatically, which is great news. Now, the other thing is I get in and you click on this other tab and you can see the characteristics. And this gets into the severity. Now, this is a little bit controversial, so don't blame the messenger. But this talks about the number of hospitalizations and the deaths. Again, one death is too many. We don't nobody is happy about death. We're all going to die, but nobody's happy about deaths. So we'll be sensitive when we talk about the death category. But hospitalizations, this talks to the severity of the virus. There's been, and this is from the start of the outbreak, so 1st of March in this area, the number of hospitalizations in our district for age 0 to 17 has been 1. And that's somebody that's been admitted in that category. Now we know they recovered because if we look at deaths, no one has passed away from COVID that has been under the age of 40. Again, no one has passed away. So kids, very, very safe. That's not our only concern. We're concerned about our staff, our administration, our community. Then you get into the number of hospitalizations by these other categories. It goes up and up. There's my category. And then obviously we know that, elderly folks, people with low immunity, with secondary, cases or secondary issues, they're at the highest risk. Their immune system is low and viruses are nasty. And we see that, yes, that's the case here. Most of the hospitalizations have been 70 plus. And then you look at deaths, and out of the, I think it's 50 some total deaths in our district, you see 1, 2, 5, so 8, 5, 6, 7, 8. Okay, I did my math right. I can add. Anyways, there's only been 8 deaths for anyone under 70 in the whole district, but the majority of folks, and then, we see healthcare systems are definitely, long-term care facilities are definitely hit most dramatically. So we want to protect those facilities as much as we can. And they're, you always are, right? You're always keeping those very sterile. I have a buddy that, owns some of those healthcare systems in Twin Falls, and he's taking, very drastic measures to make sure that it's safe. And hey, that's what we need to do there. So this shows you the severity. Again, I have a secret spreadsheet if you want it. You can email me. I thought it was probably a little controversial because it gets into the ratio of people that, for every positive case, there is a number of asymptomatic, and that number is very, it's now kind of political where, some people on one side say it's, 20-to-1 ratio. On the other side, you get down to a 5 or a 6-to-1. I picked in the middle, 10-to-1, so whatever. I try to stay in the middle. I try to stay neutral. But you get into the actual percentage, the risk factor, and it's less, very low numbers, less than percents, less than 0.5% of the severity of it in our area. Again, this is in our area. Not making a statement, but we do need to assess the risk factor of this virus in our area versus just the number of cases. All this has been taken into consideration. These are great numbers. If you go, I've already shown you this. Again, I'll show you all these links. And then you can actually get in, St. Luke's has a great site that'll allow you to go into their records and see for, they're a very large hospital in the area. And, St. Alphonsus as well. But this gives you some good, accurate data as well. And so I can go like last 15 days and I can say, hey, give me Gooding County, because there's a St. Luke's facility in Gooding County. And what's actually happening in the hospitals, again, they were green. And, here's the data that backs it up. On the 13th, which was yesterday, there was 8 people tested. 1 person test positive. Looks like we're still waiting on results for 3 others. The day before that, 8 people tested. 1 person positive. The day before that, 11 tested, nobody tested positive. The day before that, 9 tested, nobody positive. These numbers are great, and this, this helps understanding that, the healthcare system is in good shape right now. And these are accurate numbers coming out of the hospitals. And, you could say all the areas, you can go into Ada County. And so this is a great resource, and I'll show you the link here. Again, I'm not trying to make any political statement. I just want to let you know that we've been doing a ton of thinking, a ton of research on opening school and assessing the risk of the virus and making sure that we are doing our best. And next week we're going to show some videos of what we're doing with desks and how we're protecting the teachers and the students and the faculty. We're doing all that we can, and we're very confident with opening up in the yellow category. Here's the analytics to back it, and the trends are great. We want those trends to continue to go down, and we're in Gooding County, right? We can, and this is my assessment, not a statement. But when I go around, we're not super. We're not taking super precautions, right? People don't wear masks here, and that's our choice. People, they're very, we talk to people. We're within, sometimes people's private space, which is less than 6 feet, and it's good to see that even without taking those, extreme shelter-in-place precautions, no mask wearing, those types of things, that the numbers are still going down. And say your prayers, cross your fingers, give us good thoughts as we open school, that those numbers will continue to stay low and that we'll be able to continue in classroom education. It's proven, some kids can do remote learning. I have 2 kids, one can do it, one cannot. And so, for folks that can and folks that want to have the option of having remote learning, we have that here at Hagerman Joint School District. But for the others that, the kids need to be in the classroom, they need to be instructed, we want to keep our doors open and we want to continue to provide that education and make sure our kids don't fall further behind. Spring was tough. We're going to have to, kind of start over with some kids. But hey, we are planning to open August 24th. Feel free to send me comments. Feel free to email me. But, we have your kids, the community, our faculty definitely as in consideration to make sure we keep them safe. Thank you very much, and feel free to reach out to me. Stay safe.